Our next section is going to review measurements of mobility and range of motion in our pediatric patients. A common test used in pediatrics, as we mentioned before, is the sit and reach test. However, variability in the sit and reach test can occur as hamstring length decreases, but mobility of the back increases. This is why it is important to not just complete the test and see if the patient can touch their toes, but also monitor movement in the spine, hips, and pelvic region. Touching the toes is considered a normal accomplishment of this test and is an assessment of back and hamstring flexibility. However, for many kids, it could be considered normal to not be able to touch their toes. This could be due to increased leg length during their growth. The child may have normal flexibility in their back and hamstrings, but due to their long legs, they'll be unable to reach and touch their toes. In a different situation, a patient may be unable to reach their toes, and they might actually be able to touch their toes, due to hypermobility in their back, and they are inflexible in their hamstrings and decreased pelvic mobility. So this is when we're going to look at our case example. In our case here, our 12-year-old patient, she had a history of back pain. If we were to just use a sit and reach test to assess her movement, we can tell that she fully passes her sit and reach test. She's able to fully reach her toes with her knees extended. But we notice with her is that she has decreased hamstring length, and as we checked her back and did spinal assessment, she had hypermobility in her lumbar spine and had pain in that area. So this is a case and an example where the sit and reach test is actually failing the patient. We're seeing that a sit and reach test is passed, but they're having hypermobility in their back and they're not moving adequately in their hamstrings and pelvic position.